right. Matt, we're just going to get started with this assessment.
Okay.
Do you need anything before we get started?
No, I'm fine. Thank
Cold? Do you need anything to eat or drink before we...
you. No, I'm good. I ate over at the other hospital, so.
Okay, good. Okay, well, if you change your mind and need anything, please just let me know.
Okay.
So we already went ahead and got your weight and your vital signs as you were coming in. Do you happen to know how tall you are?
6 foot.
6 foot. Perfect. Thank you. And they showed me your vital signs, and it looks like your blood pressure is a little high. Does it always run a little high like that?
I have high blood pressure, and I went to the other hospital this morning before I was able to take my blood pressure medicine, so I haven't had those today.
Okay. Well, we're going to call the doctor after we answer these questions and everything, and we'll make sure we get you your blood pressure medicine today. Okay, thank you very much. So at this time, one of the things we do before we start signing a little bit of paperwork, and I'm going to start explaining a few things to you, we'd like to go ahead and do a skin assessment. And that just kind of checks you for any injuries, anything that we might need to be watching while you're here, like if you have any type of injury or cut or anything.
Okay.
We'll just ask you some questions, make sure that we're addressing everything that needs addressed. And we're also going to go just check through your belongings and make sure that there's everything in there is safe and it's safe to be on the unit. Does that sound okay?
Yeah.
Okay,
No,
so we'll go
okay.
ahead and get up and do that now.
Okay.
Don't forget that whenever you're doing the patient search and skin assessment, you want to ask one of the mental health protection workers to be with you. If the patient is female, please ensure that you have a female associate present. If our female patient is not comfortable having a male present during the skin assessment, it is fine to just have 2 female staff members present during the skin assessment with her. All right, Matt, thank you very much. You did a great job. I did notice, just like a little burn you had on your arm. Is that old? Has that been healing?
Yeah, it's old. Yeah, it was from smoking. I dropped a cigarette on my arm, so.
Oh, okay. How often do you smoke?
I smoke about a pack a day, probably.
Okay. And how long have you been a smoker?
20 years.
Okay. And you've remained a pack a day throughout that time?
Yeah, about that, yeah.
Okay. All right. Well, other than that, I didn't see anything concerning on your skin assessment. Everything looked great. All of your belongings were safe. There was nothing in there that we wouldn't feel safe being on the unit except for your cell phone and charger.
Okay.
So those items have been locked up in a belongings bin. And you'll see a board on the unit with your name on it, and it also has your doctor's name, and it will list a bin beside that so you know the bin number where your belongings are.
But all my clothes I can have?
Yes.
Okay.
None of them had strings. That's the only thing we're concerned about.
Okay.
And so, yes, they'll all be in your room and ready for you when we're done.
Great.
Okay. And so then I think we can go ahead and get started with our consent forms. Are you sure you don't need a drink or anything before we continue?
No, I'm fine for now. Thank you.
All right. So now this is your folder that we're going to be giving you, and this is going to be yours to keep.
Okay.
So right here we just have some admission information, and that's going to be yours. This folder you'll get to keep too, so we can put all this back in here.
Okay.
This is a wide-ruled notebook for you. It's great for journaling, and it might be recommended to you in some of your groups.
Okay.
Another thing this is really good for is when you have questions for the doctor. It's always so tricky for people to remember when the doctor comes in and there's pressure to remember what you needed to ask. So it's always a good idea to write those questions down as you have them so that when you do see your doctor, you remember everything that you wanted to ask them so that you're a little more at ease.
Okay.
So that's going to be in your folder also. This is just kind of some information about our facility and the unit for you. We also have chaplain services here if you feel that would provide any comfort to you. This explains a little bit about our groups, and also this is something that we're going to save for the end of your stay here. This is what we call a crisis plan.
Okay.
And so we fill that out just to give you an idea of steps you're going to be taking or things you can do if you start to feel the same way you're feeling now.
Okay.
And then this very last page is a discharge checklist, so we make sure that you have everything you need before you leave, and we have everything before you leave as well.
Okay.
All right. And then over on this side, we have, the first thing we have is a notice of privacy practices. This is going to be yours to keep. You don't have to sign it. It's just for your information. We do our best to keep your information private. When you were over at the other hospital, it looks like you already signed your admission consent and your Fed form, they called it. Does that ring a bell?
Yeah, maybe. I signed a couple of things over there. I'm not exactly sure what they were. I know one was an admission consent. I'm not sure about the other one though.
Okay. So that other one, what it's saying is just that, like, if a family member calls to check on you, it's giving us permission to say, yes, Matt is here. It's not giving me permission to release any private information about you to them, just to confirm that you are here so I can transfer that call out to you and you can speak with them.
Can I leave a list of people that I don't want that to happen? Like if I'm talking about my wife, we're going through a divorce, and I really would rather she not know I'm here.
Yes.
Although I'm sure she'll find out at some point in time, but I don't want her to know anything about what's going on.
That's perfect. And we can even set up a HIPAA password for you if you like.
Okay.
So basically anyone who calls, I would have to ask for a password before I would confirm.
Okay.
And then also, anybody who you would like us to release information to, we have a different form called a release of information that you can put their names on.
Okay.
So that, such as if your mom calls and you don't mind if we give her an update on how you're doing while you're asleep or anything like that, that you're just saying it's fine for us to do.
Okay. Yeah, that's fine.
So that Fed form and the admission consent form are already signed. I will note that there's an exception that you would not like us to confirm to your wife that you're here right now because of the situation with your divorce. So the privacy practices, this is a patient screening form, and basically it's just asking if you have any communicable diseases or any immunosuppression that might make you susceptible to getting something if you were around an animal, such as a dog or a miniature horse.
Okay.
Do you know of anything like that you have?
No.
Okay.
No, I don't have any allergies to animals or anything like that. So.
Okay. And the reason I asked specifically about a dog and a miniature horse is because those are therapy animals that we have come visit the facility.
Oh, okay.
So as long as you're okay with being around them, I just have you sign right here at the bottom, and it just says that you're okay with that.
Okay.
So.
Sounds fine. What is today's date?
Today's the 8th. And then this other form right here, this first page goes over your rights as a patient. Of course, you have the right to receive informed treatment, to participate in the decisions about your care. Please ask questions, and you also have the right to refuse anything if you choose to.
Okay.
You are here as a voluntary patient. And also then responsibilities, we ask in return with those rights that you please provide us honest information, you're receptive to information, and we ask that you please do ask questions when you have them, because we want to give you the best care you can have.
Okay. Okay.
And so then I just have you sign right there.
Okay.
Perfect. Thank you very much. So I will take these. And then everything else, if you want, actually, you can put back in this folder, and that's yours to keep. And if you want to put your name on it. All right, of course. Thank you so much. All right, Matt, so now we're going to go ahead and get started with some questions. I know you probably answered several of these, or were asked several of these questions when you were over at St. Joseph.
Yeah.
I just kind of want to clarify the information and make sure we have everything.
Okay.
Is that all right?
Yeah, sure.
Okay. Now, do you have a contact person that I would list on one of those forms in case there was an emergency?
Probably my mom.
Your mom?
Yeah.
Okay. And I think I already have her information down on the other sheet. Is
I
that
gave
phone
it.
number?
And I gave it to them over there too. So.
Okay, so that's all the same. So I'll make sure that we list your mom. Our facility does have restraints and seclusion, so that's another situation in which if for some reason you were to go to restraints or seclusion, which I don't foresee being an issue.
I don't think that's going to be a problem.
I don't think so. But I would notify your mom just in that situation. Okay. And now, do you have something called a do not resuscitate order?
No.
No? Any living will or durable power of attorney?
No.
Okay. Do you currently have a job right now?
Yeah, I'm self-employed. I have a construction business.
Okay, wonderful. And can you just tell me a little bit generally about what's going on and what brought you to the hospital?
So, my wife and I are going through a divorce. We've got 2 kids. They're 5 and 8. They're with her. I kind of anticipate a fairly lengthy custody battle. I feel like I've been depressed for a long time, but here within the last couple of weeks it's just been really bad, and I start thinking about maybe it's just not worth living anymore, So that really scared me, and so I reached out to my sister at the time, and she thought that I probably needed to get some help because I was having these thoughts, and they're becoming a lot more frequent, so that's why I went to the hospital.
Well, I'm so glad that you did reach out to your sister. I'm so glad that you both reached out to us. A lot of people, they go through these very difficult situations in their life, and it sounds like you're going through one right now.
Mm-hmm.
I don't want you to feel like this is a bizarre situation or that it's some sort of bad situation that you're here. You're here to get help, and that's what we want to do, and so it's great that you've come here so that we can provide that care to you.
Okay.
How long have you been having these thoughts that life might not be worth it? Do you feel like
probably the last 2 weeks?
2 weeks?
Like, 'cause I feel like I've been depressed longer than that, but I've never really felt like I wanted to end my life. But the last couple of weeks, I've kind of been considering it.
Okay. And are you having those thoughts throughout the day, all day, every day, or is it intermittent, or how do you feel about it?
It's not all the time, all day, but I have them periodically throughout the day, yeah.
And when you're having these thoughts, have you thought about what your plan might be to complete such an act?
Yeah, I was going to take all my blood pressure medicine.
Well, and I see that you're making such a great effort to come here and get help and feel better. As it is right now, do you feel that you're safe in the facility? Do you feel like you might want to try to harm yourself while you're here?
No.
Okay.
No. I feel like I can be safe.
Perfect. Thank you. And if for some reason that changes, please just let one of us know right away. We're here to help you with that. And in addition to those stressors, any other stressors in your life in addition to the divorce, kids, and it sounds like you have high blood pressure as well?
Yeah, not really. I mean, business is kind of, it is what it is. It's up and down, and we're in a pretty slow time right now, so money's tight too, and so it's just kind of living paycheck to paycheck. That's hard because I'm giving some money to my wife and the kids too, so
Of course.
yeah, some financial problems.
Now, is this the first time you've ever had thoughts like these?
Mm-hmm.
Okay. Have you ever had a previous suicide attempt?
No.
Okay. And whenever you are having these thoughts, have you ever had thoughts to harm someone else?
Oh, no.
I didn't think so. You seem like a very sweet
Yeah,
person.
no, I wouldn't do that.
And this might be kind of an awkward question, but please just, think back and answer as honestly as you can. Do you ever feel like you are maybe hearing or seeing things that other people might not be hearing or seeing?
No, I've never had that.
Okay. Any legal issues? Have you ever been arrested before?
Nope. I've had traffic tickets and things like that, but I've never been arrested.
Yeah. Traffic tickets, haven't we all?
Yeah.
All right. No other probation or anything like that? Okay. And have you ever had something called a TB or tuberculosis test? Where they maybe put a needle right under your skin?
Maybe a long time ago, but it's been years since I've had something like that.
And do you ever remember them telling you that you were positive for anything?
No.
Okay, perfect. And besides your elevated blood pressure, do you have any other medical issues that you see a doctor for?
Not that I'm aware of, no.
Okay.
Oh, I guess I can't hear very well out of my right ear. I had an industrial accident some years ago, and I've got some partial deafness in my right ear, but I don't wear hearing aids or anything like that.
Okay. And you've seen your doctor about it, and he manages it?
Yeah, I just have some partial hearing loss.
Okay. Okay, great. Well, if I'm ever not speaking loudly enough or you need us to make any, or give you any assistance with that, please let us know so that we can make adjustments.
Okay.
Do you wear glasses at all?
I do, yeah. I'm wearing contacts right now.
Okay.
I think I brought my glasses if I remember.
Okay, well, we'll check your belongings, and if you do need those at any time, please just let me know. Can you tell me the month and the day?
January 8th.
Okay, perfect. And you know what year it is?
2016.
And do you know where you're at right now?
In Via Christi Hospital.
Perfect, that's good. Okay, we were just making sure that you're oriented to where you're at, place, time, all of that jazz. So, and have you ever used, besides cigarettes, have you ever used any recreational drugs, anything?
No, when I was a kid, I smoked some marijuana, but I mean, I haven't done that for over 20-some years.
Okay, so more than 20 years ago. Was it more experimentally, or was it pretty consistent?
Yeah, it was experimentally. It was just a couple of times.
Okay. And any alcohol use?
Yeah. Generally on the weekends, I'll drink anywhere from 12 to 24 beers over the course of the weekend.
Okay. And that's every weekend?
Pretty much, yeah.
You feel like your stress is contributing to that?
Probably. I mean, I've always had beers on the weekends, you know, watch the game or whatever the case may be, but I may be having a few more now since my wife and kids have moved out. It's just, you know, get kind of lonely.
Understandably. Have you ever had to go through treatment or seek treatment for that?
No.
Okay.
No.
And now just to check, medically kind of head to toe, I'm just going to name off some of your body systems just to try to spur in case you remember that you are having any issues in one area, like your heart or intestines, stomach. Do you ever recall any issues going to the doctor?
No, other than just the high blood pressure. And my doctor did tell me that I have high cholesterol, but I'm not on any medications for that.
Okay. And now, have you had a flu shot this year?
No.
Would you like to have one?
Sure.
Okay. We can handle that while you're here. And because you are a smoker, you are more at risk for pneumonia. Would you be interested in getting that vaccine while you're here, or have you already?
I haven't, but I'm not interested in the pneumonia.
Okay. And Matt, at any time have you ever been in a situation or relationship where you felt like you were abused or neglected?
No.
No? Okay. Never felt in danger or been harmed by anyone?
No.
Okay. And do you have a family doctor you go to?
Mm-hmm.
Okay. And what's his name?
Smith, Dr. Smith. I think John Smith, maybe.
And he works out of Wichita?
Yeah, he's up on 21st Street somewhere. I could probably figure it out for you.
Oh, that's okay. I'm sure we can. Good old Google. We
can
find it. And what pharmacy do you use?
Walgreens.
Right by your doctor's office?
Yeah, it's over there at the 21st and Webb, maybe something like that, I think.
And have you ever been to anybody to discuss these feelings besides your family, like such as a therapist or a psychiatrist?
No. No.
And this is your first time ever coming to our facility too,
Yeah.
correct? Okay. And are you interested in having a chaplain come see you, speak with you?
No.
Okay.
No.
Any religious preference?
No, I mean, I'm Christian. I go to a Lutheran church, but if I want that, I can reach out to our pastor, my pastor.
Okay, yeah, sounds great. Is there anything else that you feel like you'd like to talk to me about that we didn't discuss, or something that you feel like...
How long will I be here, do you think?
Generally, you're here about 3 to 5 days.
Okay.
The unit you're going to be on is called 2 West,
Okay.
and so you might notice that other patients too on that unit dealing with similar problems, things
Okay.
like depression, recently having thoughts of maybe wanting to harm themselves, or perhaps they went through traumatic experiences in their past. So you're going to have groups that you go to every day, actually a few groups a day. And as a group, you'll kind of discuss these issues and hear what coping skills people are using. Do they find those effective? You get to hear from other people going through very similar things, and that's usually very helpful to people.
Okay.
Every day you'll see a doctor,
Okay.
and you'll also usually see a social worker is around if you need her, and she'll touch base with you throughout the week.
Okay.
And if you foresee any issues with follow-up care, please just let us know. If there's anything we can do to help you meet your needs, please let us know.
Okay.
Right now I'm going to go talk to one of the nurses on that unit. I'm going to let her know just a little bit about what we discussed so that they can anticipate your needs and we can get you all set up there. And then I'm going to come back and get you, and we'll get you upstairs, and maybe
Okay.
you can, I know you've had a long night, maybe you can get a nap, or
Okay.
just whatever you need, okay?
All right, so you just want me to stay here for now?
Yeah, if
Till
you don't
come
mind.
back?
Are
No,
you
that's fine. Yeah,
comfortable
I'm fine.
Do
Yeah.
you need a drink or anything
Nope,
while I'm
I'm fine.
gone? Okay.
No, thank you.
All right, well, I will be back to see you then.
Okay,
All right, thank you,
thanks.
Matt.